Hello, my name is Kathleen Lisson. I am a lymphedema therapist and the author of Stress Reduction for Lymphedema. And today I am coming to you from my office in San Diego. I want to share some information with you about a condition called tuberous sclerosis. This is important for lymphedema therapists to know about because some patients with tuberous sclerosis will also have primary lymphedema. So we're talking about a condition called tuberous sclerosis complex. It's a genetic disease. So there's problems, the missing gene of TSC1 or TSC2. And this is part of the mTOR pathway, which keeps cell multiplication in check. So these genes prevent tumors. So if the client does not have these genes, they end up having these non-cancerous tumors growing. It can affect every organ of the body. About 1 in every 6,000 people have TSC, and that is 1 million people worldwide. And 7% of people with TSC have lymphedema as a symptom. So it can be lymphedema that's congenital, so they will often see it in utero or right at birth. It can sometimes just develop into swollen ankles, so it won't be a full-blown case that a lot of people could readily diagnose. It will just be they'll have some swelling in their ankles. If it's a male client, they can have scrotal edema in the scrotum. So they will have screening for non-cancerous tumors throughout their life, starting when they're a child and throughout their adulthood. Again, these tumors can affect all organs. And many will have cardiac rhabdomyoma. So I have a client, a pediatric client that has TSC. So she was diagnosed with this in utero because she had cardiac rhabdomyoma. They may also have changes that they can see in the brain. But they are at no greater increased risk of cancer. They have tumors, but they're not at risk of cancerous tumors. So what do we see as lymphedema therapists when we look at these patients? We'll see skin issues. They can have lesions on the forehead or throughout the body. They can have lipomas. They can have lymphedema. So in the people that have lymphedema, that have tuberous sclerosis, often they are also female. Often they also have kidney issues. And we need to know as lymphedema therapists that the percentage of people with TSC with lymphedema is higher than the percentage in the general population of people who have primary lymphedema. We need to tell our patients with tuberous sclerosis that the urgent care or the emergency room may not suspect cellulitis when they get a rash on that limb that has lymphedema, but they need to know as the patient's mother and family about cellulitis, because this may not be the first thing that the healthcare provider who doesn't know about lymphedema would suspect when they see a rash on a limb or part of the body that has lymphedema. In our health history form, we may see some pharmaceuticals that are prescribed for tuberous sclerosis. There is no cure, but sometimes people will be given rapamycin, epilepsy drug, and chemo mTOR inhibitors to help control the symptoms of the disease. And the patients may be qualified and get liposuction for lymphedema. They may get liposuction to reduce the lymphedema in the limb that has lymphedema, the solid predominant disease. So if you have a pediatric client that has tuberous sclerosis and has lymphedema, there are resources out there for the family. The Pediatric Lymphedema Alliance is a really great resource. And for the lymphedema therapists, they have an online continuing education class on pediatric lymphedema, the care of pediatric lymphedema. There's also a nonprofit called Brylan's Feet Foundation, which helps with pediatric lymphedema. There is a summer camp in America called Camp WatchMe, that all type of pediatric clients with all different types of lymphedema can come and attend this camp. This is a really great opportunity because for most people, this Camp WatchMe is the first chance for them to not be singled out, to have other children, other young people that can be their friends that understand their lived experience of having lymphedema, that they do not have to explain and explain and explain why they have a garment, why they're bandaged, why one leg is bigger than the other. So Camp Watch Me is a great opportunity. It's also an educational opportunity for the parent or guardian to learn in an intensive purpose over the course of the week how to treat, how to help their child, and help with the conservative treatments of lymphedema at home for their child. There's also, if people have lymphedema, both primary or secondary, Lymphy Strong is a really great Facebook group where you can get together with other people who have lymphedema and share and support one another and have that same understanding of where you don't have to explain why you're wearing garments, why you're having these difficulties to the people in the Facebook group Lymphy Strong, because everyone has lymphedema there. Also understand that the patient will have a care team. There's different TSC groups of expert clinicians and professionals, like at Stanford. There's a group in San Diego. There's a group in Boston. There should be some resources that we can refer our clients out to when they have different issues, because someone who doesn't understand what TSC is and is a medical professional may be looking at the wrong diagnosis, the wrong conclusion, because TSC will affect each and every organ in the body. So they need to understand that it may not be the usual presentation of what's going on with them. It may be because the client has tuberous sclerosis complex. Also, Lymphedema Education and Resource Network, another excellent resource for learning more about lymphedema and joining. If there is a state chapter in your state, going ahead and joining that state chapter and getting access to resources and also other people who understand about lymphedema. So this is just a short overview of some basic information about tuberous sclerosis complex for people who are lymphedema therapists. Thank you and have a great day.